Hello, everyone, and welcome. Today, we will be discussing the health insurance specialist careers. My name is Cynthia Bennett, and I will be your facilitator for this session. So, as health insurance specialists, this career has the opportunity for advancement. There's also lots of demand for professionals who understand health claims processing and billing regulations. Also possesses accurate coding skills and can successfully appeal underpaid or denied claims. And then also demonstrate workplace professionalism. So, all these skills are required in order to be a successful healthcare insurance specialist. And we'll learn more about these throughout this presentation. So, we'll also be learning about health insurance, hold harmless clause, healthcare providers, CMS, also known as Centers for Medicare and Medicaid, ICD 10, CM, ICD 10 PCS, HCPCS, Level 2, and CPT coding. And we'll also learn a little bit about medical necessity on the next slide. So, medical necessity. This is really important when we're working in the reimbursement part of healthcare. So, medical necessity is basically linking the procedure or service reported and making sure that they are connected, they're related. So, this first example is the provider will not receive payment because the patient came in for a knee x ray, but the diagnosis was shoulder pain. So, as you can see, there's no medical reason why the patient should get a knee x ray if they actually have shoulder pain. So, in other words, the diagnosis has to correlate with the procedure that's actually being performed. So, that's why this one will not be a valid reason, and it will also be denied for medical necessity. So in our second example that we have here, the provider will be reimbursed for this claim when submitted with the CPT code for chest x-ray, and then also the patient has shortness of breath. Because it makes sense. If the patient has shortness of breath, the doctor may want to do a chest x-ray to rule out pneumonia or to rule out some other type of disease. So those two make sense. So that's what they're talking about when they're discussing medical necessity. So some of the career opportunities that you will be eligible for is to be a coder, a health insurance specialist, and you'll notice that the names will be used interchangeably. So each organization, each company, they can name jobs whatever they want. So it may be health insurance specialist, it may say reimbursement specialist. So it just depends. It could say collection specialist. So just different names. So I always suggest that you use the search bar in, for example, Indeed, and put in insurance specialist and then see what jobs come up. Also, you can be a claims examiner, medical assistant, and health information technician. So here's just a little knowledge check. So when you are close to graduating from your academic program, how will you identify careers opportunities available in your region of the country? So you'll just go to Indeed, you'll put in health insurance specialist, and then it will pull up all of the jobs that have anything to do with the insurance specialist. So now that we're doing a lot of remote positions, you also can put in remote, and then it will also pull up jobs that are just for remote. So you can do it either way, just depending on what you're looking for. So if you're looking for something in a specific area, of course, you'll put that city in. And if you're looking for something remote, you would use the word remote, and then it will pull up what positions they have available. So for medical coding and reimbursement positions, We should use the AAPC website. They have a job board there, and then there are some other opportunities there. So I say use all of your resources. Use Indeed, use AAPC. So all of your resources when you're going to look for a job opportunity. So training and education, this is going to be very important. So for the healthcare insurance specialist, you'll get some general education on anatomy and physiology. So you won't have to know it as extensive as like maybe a medical assistant or a nurse, but you will have to have some general knowledge. You'll have some general knowledge of coding and reimbursement, good verbal and written communication, definitely able to critical think because there will be different situations that will come up that you will have to try to resolve the issue so that the uh, healthcare organization can be reimbursed. Also, some data entry and then definitely internet access. So, some programs will have a student internship, and this will be on the job professional experience prior to you graduating. Although it is unpaid, students are expected to act as a professional. So this is very important. This is preparing you for your new career. So we should always act in a professional manner and treat it as if though we were going to a job and we were getting paid for it. So there are sometimes you can actually get hired right from your externship. So really, really important that you act in a professional manner. So some of the job responsibilities. So the scope of practice for this profession delineates qualifications and responsibilities. It clarifies the supervision requirements. So, as a health insurance specialist, some of the job descriptions that you may see, and it will vary from organization to organization, what they're looking for as far as the responsibilities for that particular position. So basically, it summarizes activities, qualifications, responsibilities, skills required for that position, and it will also include a list of tasks. So here's an example of some of the tasks. It may say accurately post payments, charges, adjustments to patients' accounts, and then also their accounts receivable record. So, like I said, it depends on the organization and what they're actually looking for, what will be included in that job description. So, under the scope of practice, these are just some key words and definitions that you may want to become familiar with. So, definition of professional, and this is just someone who interacts with the patient to clarify health insurance, their claims, if anything's denied. So a lot of times patients will come in with questions. So you have to be able to interact with patients. So some of the qualifications will include that you graduated from a health insurance specialist program, also has some experience or anything that's related, also working knowledge and demonstrated proficiency in at least one insurance company's billing and collections process, great organizational skills, the ability to learn to multitask, proficient use of computers and software, and then a certification through AAPC or AHIMA. And there are different types of certifications, and we'll learn more about those as well. And then these are just some of the responsibilities and what they actually mean. So be able to use a medical office management system to process the claims. Assign codes. So this will be your diagnosis and your CPT codes. Managing the patient's records. Communicating with the patient, providers, and the insurance companies. And then also remaining up to date for the changes that are within healthcare. So there's always going to be changes. So once you join a healthcare organization like AAPC or HEMA, they have monthly magazines that will give you information on the different changes that are occurring. Then also the supervision requirements. This is active and continuous supervision of a healthcare insurance specialist is required. A healthcare, however, the physical presence of a supervisor at the time and place when responsibilities are performed are not required. So basically, you can work remote. You can work in a different location than your supervisor, but you still need to be working under someone. So your job as a health insurance specialist would include assigning the CPT, assigning the ICD-10 and HCPCS codes, applying insurance regulations, posting payments, charges, and adjustments, preparing or reviewing claims, reconciling insurance payments with their remittance advice. So that's the document that comes back after we submit the claim to the insurance company. That document is going to tell us how that claim was actually processed. Correct data errors and resubmit unprocessed or returned claims. And then other many more responsibilities. So that can be various duties, again, depending on where you work and what type of responsibilities they've assigned to that particular position. So you can work as an independent contractor. So basically, an independent contractor is a person who performs contract services for organization as part of an express or implied agreement. So basically, you won't get any benefits if you are an independent contractor. So you'll have an agreement and you'll be contracted to do specific things. So if you are an independent contractor, you may consider purchasing professional liability insurance as protection from liability when performing professional services. And then also employer liability. And this is when the organization has no liability for errors, anything that's been omitted from the claims that are performed by the independent contractor. So this is part of being an independent contractor. So starting out, that's probably not the best place to start out because you're kind of just learning. So it's probably better to work for an organization. Even if you work remote, at least you'll have someone to go to if you have questions. You won't be liable for different things. So it is recommended that you at least start off that way. Or if you have a mentor, that may work if you want to be an independent contractor. Someone to walk you through the process and to um, help you with any questions that you may have. So determining the independent contractor status. So one of the ways to determine independent contractor status is to apply common law, right to control test, which includes 5 factors. And these factors include the amount of control of hiring in the organization, responsibility for cost of operations, method and form of payment and benefits, length of job commitment, nature of the occupation. So those are independent contractors. And once you get to that point, you'll learn more about it. Now, this is just the insurance that can be purchased. So one of them is a bonding insurance, and it guarantees repayment for financial losses as a result of an employee's act or failure, and it protects the employer's financial operation. Also, business liability insurance, and this protects the business assets and covers everything in the event of a lawsuit. But if you're working for an organization, you don't have to worry about this. They already have this insurance, so you don't have to worry. There's also property insurance that you could get, and then also workers' compensation, which this is going to vary from state to state because there's different laws in each state in reference to the workers' compensation and if you're required to carry it. So, knowledge check. So, let's talk about which would you prefer, an independent contractor or a healthcare setting employee? So, did you know that an employee who earns $20 an hour would charge at least double that if they were independent contractor? So, why do you think that is the case. So again, it just depends on where you are. Some students may have some knowledge of healthcare and the medical billing and coding and reimbursement process. So they may consider being an independent contractor. So it's up to each individual person. So individual contractors are also called consultants. They can specialize in their field of study. Thus, a healthcare insurance consultant would contract with healthcare settings to assist them with establishing proper policies, procedures, and to ensure accurate claims processing and reimbursement. So, what some independent contractors may do, they may actually come on as a consultant to, work on certain claims. Um, that's one of the things that some people as independent contractors can do. And it also limits some of the risk and liability if you're just a consultant. So for professionalism, so this is really important across the board. We should always conduct ourselves in a professional manner, aim for the goals that are set or qualities that characterize a professional person. So rules for professional behavior, codes of conduct, including policies and procedures that are established by the employers to help the employees behave professionally. Employees are expected to develop skills to demonstrate workplace professionalism, which which results in personal growth and success. So basically, every organization will have a handbook that will talk more about professionalism and it's normally going to be found in their code of conduct. So a lot of organizations will have that information spelled out for you there. So these are some of the workplace professional skills. So definitely a positive attitude that will definitely help you as you're in the workplace. And this is including if you're working remote. Attitude is really important, good self-esteem and etiquette. Also good communication skills, conflict management, good customer service. Because again, we're working with patients, insurance companies, our coworkers, could be working with doctors. So good customer service is going to be really important. Diversity awareness, leadership, managing change, and you're going to get really good at managing change while working in healthcare because things are always changing. So you'll get really good at managing change. Productivity. So if you're going to do, for example, medical coding, a lot of organizations do have a productivity standard that they want all of their coders to meet. Yeah, professional ethics. So this is with your organization. And then also, if you become certified, each of the um, organizations, they have ethics as well. So professional ethics is definitely important. Team building. Team building is very important because you'll notice when you do coding, it's kind of like a gray area. So you want to be able to work in a team so you can ask questions and bounce ideas off of one another because some parts of coding may not be black and white. So you may need a teammate to kind of bounce ideas off of or your supervisor. And then again, professional appearance. So anytime we're in the workplace, so this is either remote or in person, we should have a professional appearance. So this is just an example. And so this is more so for clinical, but some medical billing and coding specialists, some of them will wear scrubs in the office, and that's fine. It just depends on what that office requires. But other than that, it's normally going to be business casual. So this is just a knowledge check. So what unprofessional behavior have you observed in a healthcare setting? So what did you notice lacking the professional skills that you have and expected the employee to demonstrate? How would you have handled this situation if you had observed differently as a healthcare professional based on what you've learned in this course? So again, you're going to get patients that may come in, they may not be in the best mood. So it's important for us to always demonstrate um, professional attitude, behavior, even if that patient is not having a good day. So we're there. Maybe we may be the person that make everything easier for them, and this is including if we're doing the insurance piece, because guess what? We may be able to help that patient with their insurance, because a lot of times patients may not fully understand their insurance that they actually have. So you could actually, make their lives a lot easier. So professionalism is really important when we're working with our patients. So these are just some terms of professionalism defined by the dictionary. So again, the attitude, self-esteem, etiquette, communication, conflict management, customer service, diversity awareness. So all the things that we mentioned in a previous slide. So these are all part of that. So telephone skills in a healthcare setting, really, really important because patients are going to be calling in for all different types of things. So we should establish a telephone availability policy. So normally you'll have office hours in which you'll be expected to answer the phone or make phone calls. Determine the appropriate number of dedicated phone lines. So normally your management will work on that for you. Inform callers who ask to speak with a provider that the provider is with a patient and not that the provider is busy. So we'll just let the patient know the doctor is actually with the patient. Can we take a message? And the doctor will get back to them. Assign 15-minute periods to schedule to allow for providers to return phone calls. So some providers want you to schedule this. Some providers will just take the messages and then they'll schedule time for themselves. So it just depends on the office and the provider who you are working for. Separate separate the reception intake area from other offices, and then require employees to learn professional telephone skills. So when you are answering the phone at the office, so answering the phone, identifying the office, and then identifying yourself. So a lot of offices will have like a quick little training to kind of tell you how they would like for that to be done. So think about one of the last telephone conversations that you had with an employee who works at a medical practice or clinic. So, what did you notice about the way that they spoke to you? So, speaking in a professional manner, not making the patient feel like you're bothering them, being glad that they actually called. So, hello, this is Dr. So and so's office. This is, how may I help you? So, that's one way that you can do it. So, did they use your name when they were talking to you? Were you placed on hold for a long time? So, one of the things that we recommend is that you go back if you're working on something and it's taking you longer than usual to say, I'm still working on the situation and I'll be back to you shortly, just to let the patient know you haven't forgotten about them. If you have a poor experience during that telephone conversation, how would you handle it different? So you can go back and think about, different scenarios that you were in and what could have been done differently. So as they're saying, state your name, the office name, don't use slang. Be sure to use the caller's name once you know who the caller is. Provide clear explanation. When you're talking, give the caller your undivided attention, and let them know that you're going to place them on hold before you actually place them on hold. When the caller wants to speak with someone who is unavailable, ask, can you take a message? Of course. Okay, so here are some of the professional organizations that you guys can consider joining. So one is AAPC, and their website is aapc.com. This is a medical coding profession. They also do billing and reimbursement. And then these are some of the credentials that they offer. They have many, many credentials. So you have to go to the website and actually look and see which credential would be more appropriate for you. We also have the AAMA, and this is for a Medical Assisting Professional Association. They have the Certified Medical Assistant. You also have AHIMA, and they have a number of certifications as well. And you can go to their website, ahima.org, for more information about the different certifications that they actually offer. So these are some things that you can think about is which professional credential are you going to pursue after graduation? You can have multiple certifications. So many people actually opt to do that. So you're not limited to just one certification or one organization. You can join multiple. If it will not be a coding or reimbursement credential, why or why not? So these are just things to consider. And then these are a list of some of the credentials that the AAPC offers. They offer the Certified Professional Biller, which is the CPB. They offer Certified Professional Coder, which is the CPC. Certified Outpatient Coder, which is the COC. And they have a number of other certifications that are listed here, and you can go on their website to learn more about them. So for AHIMA, they offer the CCS, which is the Certified Coding Specialist. And then they also offer the Certified Coding Specialist Physician Base, which is the CCSP. Also, they have the organization AMBA offers the certification of Certified Medical Reimbursement Specialist. So that credential is known as the CMRS. So as you can see, there's multiple certifications, there's multiple organizations that you can become certified with. And so that's going to conclude our session for today. Thank you for joining and have a great day.